Hi, all of you. Today I'm going to discuss a very important topic for INI-CET in OMFS. Wherever you take it, OMFS you can take it. You can take it in ortho or even in general medicine. Okay, so it's obstructive sleep apnea, or you can call it as OSA. Okay, obstructive sleep apnea. Now, if you are studying for NEET alone, this topic is not so important for you. It's very important for your INI-CET MDS exam. Okay, so it's a little selective topic. So, what is basically obstructive sleep apnea or OSA? OSA is a sleep disorder, okay, which is characterized by repetitive episodes. That's a key there. Repeating episodes, repetitive episodes of partial or complete upper airway. That's also important. Upper airway obstruction, again during sleep. It's obstructive sleep apnea, okay, during sleep, leading to decreased oxygen saturation. Now, as COVID is over, you know what oxygen saturation is all about. Okay, decreased oxygen saturation and disrupted sleep. Now, basically the key here is upper airway. Okay, repetitive episodes. So now no one is going to ask you the definition, tell you the definition in your exam. So let's come to the classification. That's much more important. Classification. So I'll just give you a question, how the question can be asked in this section. They ask that in classification of OSA, a severe case, this is a question. So there are different mild, moderate, severe and all. So severe case is defined as when the number of episodes of apnea during sleep exceed above what? So option A is 15 per hour, 35 per hour, greater than 25 per hour, greater than 30 per hour. Now correct answer is option D. So you have to understand what is something known as AHI, apnea hypopnea index. Okay, AHI. Now AHI is basically, it's a measure. Okay, it's a measure to quantify the severity of OSA. Okay, so that's what the question is. They are asking the severity. So how severe is the OSA? That is being quantified by something known as AHI. Now, how it is calculated? It is calculated by dividing the number of apneas. I'll come to what, if you don't know what apneas are. Okay, it's a breathing difficulty or complete absence of breathing. So how many number of apneas and hypopneas combined? Okay, not just apneas. I'll come to apnea, what is hypopnea, how to define them. So the number is the number of apneas and hypopneas, okay, and that is dividing the number by the number of hours of sleep. How many number of apneas, hypopneas, dividing that by number of hours of sleep. Okay, now for example, if a patient has got 10 apneas or hypopneas divided by 2 hours of sleep, just a random number I've taken. That's how you calculate the AHI. Okay, so it's expressed as number of events, number per hour. Okay, because it's per hour, it's calculation. Now, so number of events per hour. Now, what is basically apnea? It's a complete cessation of airflow through the respiratory system for at least 10 seconds. Complete cessation. Okay, there is complete blockage, complete cessation. Whereas hypopnea is a partial reduction in airflow for at least 10 seconds. So one is complete cessation, the other is partial cessation. Now this apnea and hypopnea is accompanied by a drop in oxygen saturation, or it can also lead to an arousal from your sleep. Okay, and so please note, in AHI you have got both apneas and hypopneas considered. Okay, and this, when considered, give you an understanding of the measure of the frequency, how frequent is your apnea, hypopnea, and how severe it is. So two things are important. Both apneas and hypopneas are considered. Okay, and you can calculate the frequency and how severe it is. Okay, so let's come to the actual classification. Now, this AHI is used to categorize OSA into 4 levels of severity. The first one is normal. Okay, it's not written there. Normal, mild, moderate and severe. Okay, normal means less than 5 events per hour. Events means what you're doing. You're dividing the number of apneas by the number of hours of sleep. So per hour, how many events of apnea, hypopnea is there? So normal is less than 5. It's normal, no problem. Okay. Now mild is AHI between 5 and 15 events per hour. So this is very important. This classification is very important. 5 and 15. And no, this is even important for your NEET. Not a detailed thing. At least this, if you learn, it's very good. Moderate is between 15 and 30 events per hour. Severe is AHI greater than 30 events per hour. So it's very, very simple. Less than 5, 5 and 15, 15 to 30, and greater than 30. So it's 5, 15, 30, greater than 30. Okay. Now, basically, what did we say? It gives gives you an understanding of severity of ASA. Not just that. AHI also guides you in treatment decisions. For example, if a patient has got a mild OSA, then what should he do? He should go for a lifestyle modifications. What are lifestyle modifications? Like weight loss. Okay, or avoid alcohol. This is the treatment part of it. Okay, this is the basic conservative management. Or avoid sedatives. Okay, if at all is using sedatives, avoid them. Basically, mild cases, you go for lifestyle modifications. Now, what about if it is moderate to severe? We'll come to the treatment in detail, but just to understand, use a device called continuous positive airway pressure therapy. Now, it's a very important question for your INI-CET, which is called a CPAP therapy. I'll show you the image. Then you have got various oral appliances to use, or even go for at the end level, go for a surgical intervention. Okay. Now, this particular chart again gives the same thing, less than 5, which is normal. Then 5 to 15, 15 to 30, greater than 30. Very, very, very simple concept here. Okay. Now, the next thing is, do you have any other classification other than this? The AHI index? Yes, there are few, again not very important, but just know it for the name's sake. Okay, you don't need to sit and mug up here, just listen to it and just read through it, just revise through it. What is more important is AHI. There is something known as respiratory disturbance index, RDI. Just know the name. Basically, RDI is same as AHI, except that additionally they also consider the certain respiratory events. What are they? Like snoring or something known as RERA. What is RERA? RERA is respiratory RERA, respiratory effort related arousals. Now just get up. Arousal during sleep, that's called a RERA. So these two things are additionally considered along with hypopneas and apneas. So how do you calculate RDI? The number of apneas, hypopnea, same thing, plus you consider snoring, okay, snoring events, and you also consider the RERAs per hour, same thing. So in AHI, they consider only 2 things, here they considered 4 things, that's it. Okay, now another method is something known as ODI, okay, that is oxygen desaturation index. Now it's a measure of frequency and severity again, but of oxygen desaturation, because there is apnea. So during the apnea, hypopnea events, and how do you calculate it? It is calculated as number of times, how many number of times every hour the oxygen saturation falls below 3%. Now per hour, how many times does the saturation drops by 3% or more from the normal? Okay, per hour, how many times? So it gives you so it's basically oxygen saturation. Now so we studied 2, that is RDI and ODI. Now next is clinical classification. All these are not very significant. Again, let me tell you, just listen to it. Okay, you just need to listen to it. So clinical classification, this is based on the severity of OSA symptoms, the symptoms of OSA, and their impact on the daytime functioning. The function, you'll understand this very simple. So there are 4 following categories again: asymptomatic, mild, moderate, and severe. Okay, now asymptomatic, now we are talking about symptoms, isn't it? Symptoms during the daytime, how it affects. So asymptomatic, basically understandable, no symptoms, isn't it? Now what about mild? occasional snoring, again snoring is important here, occasional snoring or mild daytime sleepiness. Basically hypoxia can lead to a kind of sleepiness in the daytime. Okay, so mild daytime sleepiness and mild and occasional snoring. Okay, now moderate is regular snoring plus and or moderate, so basically both are moderate daytime sleepiness. Now severe is loud and frequent snoring, excessive daytime sleepiness, this they can put in an option, okay, excessive just in case, plus other significant symptoms. What are they? That is severe, you have got additional symptoms, another symptoms. What are they? The patient can have mood disturbances, cognitive impairment, that is studying, learning, everything is affected, cardiovascular complications, which will come to it very soon. Again, a question was asked on this. Okay, so these are basically the clinical classification. Okay, now we have got something known as anatomic classification. Okay, the location where exactly it's located. So based on the location and severity of upper airway obstruction, we said basically OSA is upper airway obstruction. Now it includes some categories like type 1, type 2, type 3 and type 4. 4 types. Okay, so type 1 is basically, so this just learn it very simple, just remember the order from top. Okay, it is a soft palate, okay, on top. So type 1 obstruction at the level of soft palate, just below that you have got tongue, isn't it? Then just below that you have got obstruction at the level of epiglottis or larynx. In anatomy we studied what epiglottis and larynx are, isn't it? Then 4 is multiple level of obstruction. So this, remember, multi-level obstruction. So just from top to bottom, soft palate, tongue, epiglottis and larynx. Okay. Now what is asked in the question is more important for you. So just don't waste your time. Your INI-CET, for those students, INI-CET is very close. Just listen to it, understand it, and that will be more than enough. Okay. Now that was the first question. AHI, study AHI, remember AHI, revise AHI, enough. Now we're going to understand something which is systemic effects. I told you in one of the classification, the system of symptoms, you have got cardiovascular complications and all. So what are the systemic effects you have to learn? Because there was a question in INI-CET again, systemic effects of obstructive sleep apnea, OSAs, include all of the following except. So I'm also including the SR-ship questions here, okay. So it's purely an INI-CET topic again. So aortic aneurysm, cardiac arrhythmias, hypertension, core pulmonary. I'll tell you what these are. Basically the answer is aortic aneurysm. It will not be seen in the obstructive sleep apnea. Aortic aneurysm we have studied in general medicine what it is, but I'll give you a small understanding of it. Basically aortic aneurysm is not seen. Okay, it is not a complication of OSA. What is basically aortic aneurysm? It's a dilatation or dilation of or bulging of aorta, the major vessel. You know aorta. So it's a dilation or bulging of aorta. That is what is known as aortic aneurysm. Okay, we studied this in general surgery, I guess, isn't it? Now, what is the reason? Why is it not seen in OSA? Why is aortic aneurysm not seen in OSA? The reason is OSA does not directly affect the structure or function of aorta. Remember that. It does not directly affect the structure or function of aorta. Okay, now, that's all about this area. Now we have to understand certain systemic effects. I'll quickly run through it. What is important, I'll tell you. Okay, again, this is not a very important area. This is a SR-ship question. So usually you get a direct repeat. But just understand in case they ask you something greater than that. So OSA can lead to systemic effects due to two major reasons. One is intermittent hypoxia. Okay, and sympathetic activities increase. Now see, you are stressed. Whenever I've told you in pharmacology lectures, whenever you are stressed, your sympathetic activity goes up, isn't it? Dog running behind you, remember the example. So when you're stressfully breathing,